In seconds, body temperature decreases. In minutes, cell will die and decay, putrefaction starts. And in hours, body becomes stiff, then relaxes, skin shrinks. There may be some blood clot under the pressure areas of the body. In days, due to autodigestion, body starts decaying and swells. In weeks, worms and bacteria starts eating your body. In months, soft tissue completely decay, and around 4 months, only bones are left. So live your life happily, prepare yourself, and inspire others to donate body, organ, and skin. Death delays their living. With this small introduction, we'll enter into today's topic: body donation, organ donation, and skin donation. When you talk about the body donation, this body, or we call it as cadaver, once the body is preserved and meant for medical education, is must for undergraduate medical curriculum. Because we dissect the body and we show all the muscles, nerves, vessels, and the bones to the students. How these bodies are procured in before Christ or in olden days, and how they have dissected. Herophilus, he was lived in 325 BC. He was a great teacher in anatomy in Egypt. He performed vivid dissection, that is, dissection in living. And yet, he did not dissect the humans, but he has done a lot of extensive work in pig and monkeys. His observations are unchallenged for several centuries. Leonardo da Vinci, he was an artist, painter, mathematician, engineer, and anatomist. He dissected bodies in secret and he made lot of anatomically correct drawings. Andrew Cecilius, he was a surgeon and anatomist. He obtained special permission from the Pope to dissect executed criminals. He was the first author of modern human anatomy book in Latin. He was the father of modern anatomy. Then Susrusa, he was an ancient Indian physician and world's first surgeon known as father of surgery. He explained the method of preserving the dead body before dissection. And in 18th, 19th century, there were many medical colleges started in England, Scotland, and America, which leads to deficit in human bodies. This resulted in obtaining the bodies of executed persons, grave robbery, and murders. In order to end these criminal activities, Anatomical Act was enacted in various countries. 1752 in United Kingdom, 1831 in America, and India. It was enacted as Bombay Anatomy Act. It was enacted in Bombay state, which was widely accepted and passed in all Indian states. Now, based on Anatomy Act 1949, India allows those medical colleges approved by government gazette notification to procure human bodies from voluntary body donors and unclaimed bodies. Nowadays, we are getting bodies mainly from voluntary donors. They are not concentrating on unclaimed bodies. So when you talk about voluntary body donation, what is voluntary body donation? Why it is necessary? Who can donate bodies and how it is donated? So the act of donating one's own body voluntarily after death for medical education and research is called as body donation. Is body donation is necessary? Yes. It is very, very important. It helps medical students and researchers to understand the structure of the human body and for the advancement of the science. Cadaver teaching is part of basic curriculum in all medical courses, MBBS, BDS, Ayurvedic, Homeopathic, and all allied health courses. Who can donate the body? Anyone after 18 years voluntarily can donate bodies through voluntary donation forms. And death due to natural causes, death from a contagious or communicable disease except HIV and COVID-19. And how to donate the body? So filling the simple voluntary body donation form with one passport size photo, you can donate your body. Signature of close relatives and friends are required. This is to make them aware. Otherwise, once the donated person passed away, nobody knows that his body is donated. So that is why we advise to donors to get signatures from their kin and their close friends. The forms are available in Kannada and English. Medical institution or our AMC will provide a donor card with the registration number, and one can donate without registration also. So the body is, and the person is not having donated his body, but after his demise, his relatives wanted to donate his body, that is also possible. This is a form to fill the body donation after death. Now, the body is donated already, the person is passed away in home. What is the procedure to handing over the body? They can call to Department of Anatomy, call to Department of Anatomy or the institution, and they need to provide the death report given by the physician or the family doctor. So within 6 to 8 hours or up to 12 hours we can extend, the body must be shifted to Department of Anatomy. If the death occurs in the night time, we advise their relatives to keep the body in freezer box. We will collect the body next day morning. The transportation facility will be given by the institution. And also importantly, the small part of the body, for example, finger or toe is excised and given to the family if needed for the religious purpose. In this scenario, donor passed away at hospital. So the hospital is itself provide the death report, and the relatives will call Department of Anatomy, and the body will be shifted to mortuary or Department of Anatomy directly. In both scenarios, once the body reaches Department of Anatomy, we give acknowledgement letter, and this acknowledgement letter is used to apply for the death certificate from Panchayat or municipality. And this is another scenario where sometimes their relatives, close relatives refuse to donate the body once the donor denies. In such situation, we respect their decision. We will not interfere with their decisions. Even if the donor at any time after filling the form changes his mind and wants to be cremated, the department honors his wishes and we allow them. Once the body is handed over to the Department of Anatomy, we do the process called embalming. This is a preservation process. We inject almost 5 to 8 liter of embalming fluid, mainly contains formaldehyde. This formaldehyde will be entering into each and every cell of the body, then the body is fixed. Then it will be stored in formalin tanks placed for minimum of 6 months before we use it for the educational purpose. Once we take out, we can use the cold chambers also. This is the cold chamber which is we have in our Department of Anatomy. So the handling of cadavers in dissection hall, we provide due respect, adequately covered. We handle cadavers with care, and also strict warning will be given to the students in terms of publicizing the photo of the cadaver in the social media, which is strictly prohibited. So with that, we are going to moving to the second part of the presentation, Why organ donation is required in India? Every year, nearly 1 lakh people die due to kidney failure. Among hospitals that are capable of doing organ transplant, only 50% of registered with the official body. Organ donation rate in India is 0.34. That means only 0.5% of persons are donating their organs in 10 lakh people population. Approximately 1.5 lakh brain death occurs in India every year. If all donate their organs, there won't be any deficit of any organs for the needy people. More than 50% of cases, the family member either refuses to donate or not aware of organ donation. As per World Health Organization, only 0.01% of Indians donate their organ, whereas in Europe, this percentage is 70 to 80%. So for the body donation, one can directly register to medical colleges, just permission to accept the bodies. But the organ donation, we have two websites. One is from the central government. This is a website from the central government. One can go to this website and register for the organ donation. So the next website is a website by Karnataka government. So you can register in this website also. So the possible organ donation during living. So this organ donation, there are two types. One is during living, another one is after death, mainly from the brain dead patient. So during living, one can donate blood, bone marrow, hair, one kidney, liver, part of the liver, part of the lung, part of the pancreas, part of the intestine. So if you look at the blood, matching is required. So this donated blood will be helpful for the patients with anemia, blood loss in trauma, blood loss during surgery, and blood cancer. Again, there are three types of transfusion or blood donation. One is whole blood, another one is only plasma, another one is only platelets. Even this blood donation helps the donor because within 3 to 4 days, blood volume returns. Almost 5 liters of blood is present in each and every body. Within 10 to 15 days, new blood cells will generate. These generated new blood cells are more fresh and more energetic and more efficient. And the blood can be stored for a long time in the blood bank. So the next organ is bone marrow. The matching is again required. It will help the patients with the blood cancer, which reduces the high dose of chemo and radiotherapy. It can be stored for long term. The another is hair. Hair can be donated. It helps to make wigs for the cancer patient, and it gives more confidence to the cancer patient. So other organs like kidney, part of the skin, and part of the liver, part of the lungs, all these can be donated only to the blood relatives. Compatibility matching is required and the legal formalities are required. As we know, one kidney is sufficient for normal routine life with the restrictions of lifestyle and some food intake habits. The part of the skin also can be donated during living. Usually the skin is harvested from the hidden areas of the body. So this helps, or skin grafting helps to heal faster and it prevents the infection, greater and faster healing to the host skin also. It can be stored for long time. The part of the liver also can be donated. The 1/3 of the liver is sufficient to regenerate full liver. This will help to people with liver failure, fatty liver, fibrosis, hepatitis, and liver cancer. Part of the lung also can be donated. This will help for the fibrosis, cancer, and lung disease with factory inhalation. Part of intestine also can be donated to the blood relatives. It will help for the people with cancer, stenosis, trauma and intestine. And similarly, part of the pancreas also helping the people with pancreatic dysfunction, cancer, chronic pancreatitis and etc. The piece of the bone also can be donated. It will help for reconstructive surgery of the face and other areas of the bone in patients with cancer and trauma. Now the second part of the organ donation after death, this is mainly from the brain dead patient. According to the Transplantation of Human Organs Act, brain dead must be certified by a panel of 4 medical experts twice within a 6 hours interval. So most of the parts can be used. The close relatives of that patient will give the consent. It also requires all the legal procedure. So most of the organs are needed to be transplanted at the earliest. So the heart 4 to 6 hours, lungs 8 hours maximum, and intestine, liver, and so on. Kidney for the long time, 24 to 48 hours. Even the cornea also can be donated. Cornea can be donated in the body donation also within 6 hours. If the body reaches to Department of Anatomy, we can able to donate cornea also. It can be used for 2 people. Whole heart or valves of the heart also can be replaced. Even the heart muscles and conducting system also can be donated. Even the blood vessels to replace diseased or injured blood vessels, bone to reconstruct diseased or fractured bone. The muscles also can be donated, tendons also can be donated. Even all other organs, lungs, kidney, liver, intestine, pancreas, stomach, all these organs, already we have discussed, these organs also can be donated from the brain dead patients. Even the whole limb also can be donated to the needy patients. Finally, the skin donation from the brain dead patient, even from the cadaver also, even from the donated body also. If the body reaches within 6 hours, we can donate skin from the donated body also, even after death also, natural death also. Usually, one body skin can give comfort to nearly 10 to 15 patients, and this skin is harvested from the limbs, mainly from the limbs, lower limb, upper limb, back and the face. So it is difficult to harvest skin from the anterior abdominal wall. And here there is a myth. Usually when you talk about the skin donation, people may think the skin will be removed as if removed from the chicken. It is not like that. The skin is removed, only the epidermis is removed. 0.4 millimeter of the epidermis is removed. This is a photography of the skin harvesting in our department. The plastic surgery doctors, they came to our department and harvested. This is happened last month. So this is a small video where there is a how much thin skin is donated. So this is the main part of the awareness you have to create among the common people. Only very thin 0.4 millimeter is harvested. Feedback which is done by RCMT through global grant, and this is the last governor visit. Rotarian K. Palasha visited the skin bank during the last governor visit. So this is my summary.